Welcome everyone to today's webinar, How AdventHealth and Banner Health Built a Modern Financial Experience that Innovated at Every Stage in the Patient Journey. I am Laura Dierda with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I would like to start today's webinar by introducing Tomer Shoval, Senior Vice President of Sales, Strategic Accounts, and Business Development at Flywire. I am pleased to turn the floor over to Tomer to begin today's presentation.
Thank you very much. And hello, everyone. I'd like to start by thanking anyone who invested their time in joining us and listening to our session. These are challenging times, and I hope everyone and their loved ones are safe. We really hope to have an interactive, educative session, maybe even a little bit of fun, and I'm really looking forward to that. I'm super excited about the opportunity to talk about the journey that we've had at Flywire with AdventHealth and Banner, and quite frankly, I'm honored to facilitate this session with two great visionaries in the healthcare space, Brett Tinnerman and Tim Reiner, whom I had the pleasure to partner with. I think for the last 4 or 5 years, Tim at Advent and Brad first at Conifer and now at Banner Health. Allow me to quickly introduce myself and Flywire. So I'm an entrepreneur. I've done it for 20 years. Kind of my first run was in the e-commerce space. A comparison shopping engine called shopping.com from an early stage to a public company. And really, you can argue that I got addicted to the bug of entrepreneurship and solving consumer problems and really wanted to do it again. And after experiencing the challenges of medical billing, I decided to start Simply, which started to tackle that. And after a fun, crazy journey, we joined forces just at the beginning of this year with Flywire. And Flywire, just to give context to everybody, is what I love about the company, outside of the fact that it's a really fast-growing fintech startup with 12 offices globally, over 240 countries that we serve, more than 2,000 clients, 99% retention, and a 50-plus NPS score. That's in general, and you guys can see the specific numbers around one of the key verticals that Flywire focuses on, which is healthcare, with $10 billion of inpatient responsibility. 30% of U.S. households have used our platform in the last year, and we're proudly serving 4 of the top 10 health systems in the United States. To me, the best part about Flywire is Flywire puts in their mission to go after important critical verticals that are complex and really solve them in a unique and robust fashion. And we can all agree that healthcare is such an industry, and we're kind of proud and excited to continue to lead the way in the market. I think I don't need to spend a lot of time to talk about why the affordability crisis is so important, and there's an opportunity not just to help consumer and patients to really manage that aspect, but also to create a win-win situation where you can not just improve your financial experience, but while doing that with the right type of service to the patients, you create a loyal, motivated community that stay loyal to you and tell others to come enjoy. We all know that the healthcare market is more and more competitive, and also the fact that today's patients are demanding more digital options. If you think about it, each and every aspect of verticals of our lives, if it's banking, if it's groceries, if it's travel, if it's e-commerce, we all do it on our phone, on our computer. We try to do it on our own. Healthcare is not different. I think we're kind of catching up very quickly and bringing the same methodologies and the same experience to the healthcare space. And the last part that I would show, again, there's a lot of data that we can show, but we preach that if you modernize your revenue cycle, you can really get to a point that your patients are doing the collection and taking action on their own time. That is what they expect. That improves your financial performance, and that reduces the cost for the hospital. And just a recent example in the context of COVID, you can see that when we look at the percentage of online payment versus offline payments, which are basically payments that are being done with assistance from a staff member, during COVID, you can see that just another example where the staff-assisted transaction went down and self-service online payments continue to go up. Again, there's a lot of benefits for that. That's just a recent example that I thought would be good to quickly serve. And let me now really allow Tim and Brad to introduce themselves and introduce their systems. Tim, I'll let you go first.
Sure. Thank you. And thanks everybody for joining us today. My name is Tim Reiner. I'm the Senior Vice President at AdventHealth. And we're an organization that has hospitals in 8 states and serves, millions of patients annually. And we've been working with Simply Now Flywire since the summer of 2016. And the genesis of that for me was really around meeting one of our imperatives, one of our consumer imperatives. We have 5 of them, and one of those is to be an affordable and viable company. So we really aspire as a faith-based organization to offer whole person care, but to do so in a manner that provides access for consumers in an affordable fashion. That can be a challenging aspiration, obviously, in these times of COVID. Even before that, it certainly was. But our organization consists of close to 45 hospitals, a number of urgent care clinics and nursing homes, as well as ambulatory surgery centers, and thousands of physician practice locations that encompass our network. But generally, our footprint is primarily located in Florida. So about 60% of the revenues for the organization are located in Florida, with the rest of them coming in from Texas markets, North Georgia and Asheville, North Carolina, and Kansas City area, along with Chicago. And so, for me, that's this partnership has really helped us address some of the affordability concerns that are even more prescient today with COVID, as well as providing just a more self-service and modern experience for patients. If you've ever talked to your neighbors or other users of healthcare, this process of paying healthcare bills can be very confusing. And so at its very core, we sought to simplify and make that experience more consumer friendly and interactive for the patient or consumer.
Thank you, Tim. Brad.
Hey everybody, Brad Tinnerman, Vice President of Banner Health Revenue Cycle. Joined Banner in 2017. We're an integrated delivery healthcare network with hospitals across 6 states. We have everything from critical access hospitals to large community and academic facilities, about 330 clinics, several thousand physicians that we manage the revenue cycle for, 50 plus urgent care centers, around 30 imaging centers, home care, home services, retail, pharmacy, and about a 400,000 member health plan that we have. So large, medium to large health system across California, Nevada, Arizona, Colorado, Wyoming, and Nebraska. Growing, as many health systems are, acquiring and both physician practices and hospitals are opening new facilities along the way. We're in some unique areas, very broad spectrum of facilities in very, very different types of communities and locations, which makes our life challenging. We've been live with Simply, now Flywire, since 2019, and we've really evolved the relationship and grown it, as we'll talk about a little bit more during this webinar of how we started the relationship and how we've pushed it into more for our patients along the way. That's Banner Health.
Thank you, Brad. So we thought to talk about some key themes, and to me, there's no better start than talking about what I believe is one of the things that is very similar between the two of you, Brad and Tim, outside of the fact that you lead a complex organization in two of the largest systems in the United States. I think what's very unique and similar about the two of you is that you came in and put a very robust long-term vision in terms of how do you want to take the operation and the experience that you've been dealt with and bring it into a modernized era. And it's not just hey, let's do a one-time project, but it's a really a long-term, multi-year project. So I would love to hear from the two of you about putting together that vision and kind of going after that journey. Maybe Tim, you can go first.
Sure. So for AdventHealth, you're right. It was a multi-year journey, and I think the first aspect of it was just setting the foundation. So the first aspect we endeavored to make simpler was simply the post-service statement and billing process. In our legacy environment, we had what I used to joke as a faith-based system. You just had to sort of trust that your balance was correct and pay it in full entirely. There was no ability to make payment arrangements and have a routine monthly arrangement, and there was no ability to see even what the service was for or even the date of service for that matter. So it was just sort of gave the patient a balance online. And we got a lot of negative feedback from many, many consumers who obviously are seeing all kinds of different industries facilitate online bill payment capabilities. And so it was my goal to at least be on par with those other industries in offering additional details around what the consumer statement was for and that sort of thing, as well as offer payment plans and arrangements that could be backed up by a credit card. It's no longer really in the neighborhood of a Scout's honor, I promise to pay in future months scenario. This is an arrangement that's backed up by a credit card that is pre-authorized for future monthly payments. So that was sort of the first step in modernizing the capabilities. And again, that was simply to get on par with many other industries that are offering that sort of capability. And that was fairly successful. We saw a considerable increase in the uptake of interaction with with those tools, and we saw success with additional traffic driven to that portal by email and other avenues of communication as a call to action. So no longer was just the paper statement the call to action. There was additional digital calls to action in the form of email. And so we were able to drive additional interactions with patients. And the desire to interact with consumers goes back to, our senior leadership team's desire to be a much more consumer-focused company. Healthcare in general, we can beat ourselves up often for not being very consumer-focused. Many times in healthcare, it's sort of, you do things on our timeline and at our convenience as providers, and we really need to shake that, shake some of those sensibilities up and be much more consumer focused. So in many, many other aspects of our business, we're aspiring to address that. The journey then sort of morphed into a pre-service type of engagement where we have been working to deploy estimated amount due amounts and email patients ahead of their service with kind of a reminder of when their service is occurring several days in advance, and creating an expectation of the amount that they will owe. The reason that was important to me is that consumers often have a lot of confusion about what their out-of-pocket is going to be and have no idea that they have co-insurance and deductibles, and the onus, unfortunately, is on us as providers to educate consumers about their benefit plan structures and their, health plan out-of-pocket amounts and responsibilities. And so once we had the back office solutions humming, we began to undertake the challenges of prior service and time of service, partially selfishly to collect more money at the time of service. The more we can collect at the time of service, the less expense we'll incur in sending statements and additional follow-up on those balances, but also just to provide additional transparency to the patient and not, hide the ball from them in terms of what they're going to owe. So we've been working very hard and diligently at providing estimated amount due amounts in those digital engagements, and been fairly successful with getting patients to interact with that and pay their balances in advance of the services based on those estimated amounts due. We intend to do some additional innovations there with affordability around now offering loan options. So if patients have a significant out-of-pocket of $4,000 or $5,000 due to a high deductible plan, if they want to take those balances longer than 2-3 years, we can offer financing to liquidate those balances. In some cases with a promotional rate and others with an interest-carrying mechanism, but nevertheless attempting to really address the affordability, knowing that in some cases these balances are another car payment in size, and some consumers just cannot handle that. So just allowing for additional mechanisms for reducing the monthly payment to a portion that is manageable for those consumers.
Thank you, Tim. And I can add as a partner that one of the things I mostly appreciate about Advent and about your leadership in the context of putting a roadmap and executing on a vision is, we've met, our teams met twice a year, either at your facilities or ours. Sometimes we even did consumer testing to kind of see how they interact with different concepts that we've had. And every 6 months, we've kind of refreshed the roadmap and what's important. And quite frankly, we're still in the middle of that. We're now working on exciting ability to add the affiliated bills into that kind of complex hospital bills that patient struggles with. So for me, one of the great things about your leadership and the way that you've been managing that is you've kind of built that long-term vision, and then you sliced it into different time frames and worked really well with partners like us and I'm sure others to go about that. Brad, maybe you can tell us a little bit about the journey that you put at Banner.
Happy to. Thanks, Tomer. Yeah, like I said, I started at Banner in 2017, late 2017, and coming on board, I was asked to take a fresh look at the revenue cycle services provided at Banner. We knew we needed to modernize some of our technologies and platforms. We needed to create a stable environment, but we also are a growing organization, so we needed to make sure that we could scale. So those were some of the things I was asked to do. The patient financial experience was a big part of that. Obviously, we want to drive net revenue, lower our cost, accelerate our revenue cycle, but that patient financial experience is really important to us as well. Like I said earlier, we are a health system, but we also have a health plan. So we want to make sure that we create an opportunity for our members in the health plan to receive care and not defer care. So we want them to have some level of spending power so that they can receive the care that they need, and it doesn't turn into a catastrophic event where we end up getting hit on the health plan side. In general, as we looked at the patient financial experience, as we call it, we had to look through multiple lenses and get our definitions straight on how our organization was focusing on that. So we hear a lot of terms of patient financial experience, customer service, patient experience. And we spent some time to actually define those terms and what does that interaction mean, and then divide up and figure out where there's overlap between our groups of what we're doing. So obviously, like a patient experience is an experience with a clinician. The patient financial experience is the patient, and that you can also have a guarantor that's involved. Then what does customer service mean, and how does that overlap to all those different areas? So we really needed to define all those. And then we also looked at the patient financial experience, the customer, all of those, and we decided to determine how do we engage with them? Where do they want to be engaged, and how? So we have interactions from the far front end of transparency and shopping experience, the back end with statements and balances that we're dealing with. And with a diverse health system in multiple different markets, and a very, like all healthcare institutions, a very broad spectrum of people, ages, race, everything, we want to identify how do they want to be engaged. Do they want to be engaged in a personal way? Do they want to do things on their own from a self-service standpoint? And how broad can we deliver all of those services in those ways, which is a big challenge. So that was how we got started, is really identify what is Banner trying to achieve, what does the patients need, how does that help us compete in the market, how does it make us a preferred health system, a preferred health plan, get our definitions straight, identify how to provide services and in what medium do we provide it. And that was really the bones of how we got started and how Flywire and Simply became part of that plan.
Thank you, Brad. And it's a really good segue to talk about the culture that you need to build or redefine, if you will, when you're coming in and you're putting something, some new vision and a lot of components that needs to change. I always say that, bringing a great technology, that's great, but you have to have the buy-in of the people and the leadership in order to implement it and make it successful. And I think especially for the systems that you guys run that are so large and complex and in different geographies, there's kind of a lot of challenges that comes with that, both in terms of the personnel that you run, in the partners that you bring to the mix. I know that both of you have made a lot of changes on both ends. So maybe, Brad, you can start by talking a little bit about, okay, you're introducing a vision, but that vision is very different and change is not always easy for people to accept. How do you go about that?
Yeah, thanks, Tomer. Yeah, it was a significant change at Banner to move from their past culture to more of a change management culture, which is where we are today. We have turned over and reworked almost every component of our revenue cycle. We had over 30 projects and large capital spend and operational spend to achieve what ended up being some pretty good, well, they were really good returns, frankly. But it wouldn't have happened without everyone being bought in and feeling ownership in the projects. And that meant each operational area had certain parts or full ownership, and they needed to feel comfortable that they understood why and that they had decision rights and they could be part of the selection and design. We put the tools in and around to help them make those decisions and manage those projects so that they could be successful, which meant a great team that handled messaging and marketing and communication, a great team that handled the project management side of the house, strong financial analysts to help us with the modeling of the pro formas of what we want to happen and then being able to track to see if it did happen and be able to course correct if it didn't. So it was a large team of people that are engaged into this change management process that are now being embedded into standard operations where every idea is a good idea, but it has to pass the math test. So we love things that are compliance related, but we really love things that drive either efficiency, cost effectiveness, net revenue, acceleration. And we have some pretty good models that we use when someone has an idea to vet those through our project management and finance teams to see how their idea would play out in the numbers. So we become a very analytic-driven, numbers-driven group, but it's also very creative because people love to see their ideas taken seriously, see them flow through a business model. And when things go live and they see their idea become reality and they can track the results, it's also very exciting. So I've enjoyed working with the team. We have a lot of smart people, good team that helps this stuff all take place. But that was a large change in our organization that seems to have stuck of not only through the modernization or transformation effort, but being embedded into standard operations now.
Got it. Tim, can you talk a little bit about the culture that you've built?
Sure. I'd be happy to. And I will be the first to say there's a number of my friends, it looks like, on the attendee list. So I'm clearly standing on the shoulders of lots of great folks that have helped contribute to this work. I would say, I don't know that we had as much of an overt cultural change as maybe we ought to have, but we had the benefit of having significant emphasis from our senior leadership on the consumer and that focus on the consumer and meeting the consumer needs. And so if you orient yourselves around that principle and just dedicate many of the decisions to what's best for the consumer, it can be a significant guiding light. I would say also that, as you mentioned, we're constantly kind of retooling and piloting and refining and sharpening our capabilities. And so, probably it can be somewhat difficult to work for me or this organization in that, I don't know if folks have seen the musical Hamilton, but there's a song called Satisfied in it. And I sort of feel like I'm never satisfied with the state of our financial experience. It can always improve and be better. And so we're just constantly sharpening that and never satisfied with the outcomes there. And we definitely have achieved some interesting and exciting capabilities. One of the things that we did to just illustrate that work is focus group a number of these processes with consumers themselves. So showing them these patient interactions and getting their feedback and refining the designs as a result. So even that work around presenting estimates to patients, we got a significant amount of consumer feedback. And before we deployed any of it, just made sure that was really a consumer need. And we weren't just operating under the assumption that we knew best and we were going to, voice this capability on the consumer because we thought it was what they wanted. We needed to validate first that was indeed what the consumer desired to have. And I think ultimately we've done a lot of work to culturally align the multiple aspects of the revenue cycle. We have multiple different systems of AR that produce bills that patients have to interact with. And we've done a significant amount of work to make those accessible across the continuum to the patient with a single login and putting the Simply tools inside of our AdventHealth mobile app and web tools. And so the patient can, once they log in, go in and they can hit a button and see all of the bills that are due from them, not just I have to go to my one website for my hospital balances, a different website for my physician balances, and some other website for my home care balances. We've been able to achieve, that capability to stitch together and connect multiple different AR systems balances in a single ecosystem, which is something I'm really proud of. And culturally, we've been able to move forward the idea to add in non-employed physicians to that convention. So we've not done this yet, but certainly on our roadmap is to bring in emergency room physicians or anesthesia group bills that are related to hospital services, those hospital-based partners that are not necessarily owned by the organization, but are significant partners. And those are some interesting cultural changes to make to affect a truly consolidated bill so that patients can see all of the various balances they may owe for a given service, not just the hospital or the individual physician due balances.
Got it. And I have to say to the two of you that, there's a say that kind of culture eats strategy for breakfast. I wholeheartedly believe in it. So we talked about the strategy. You got to put vision, you got to put ambitious goals, but then you need to have the team to help you make it happen. And, I can tell you for both of your organizations, you put a lot of efforts to put the right team. You both, I've seen insert great people to join you. You connect them. Brad, as you said, you kind of talk about excellence, about data-driven approach, about any idea is possible. And I think that's so important. That's the lifeblood of executing that vision, because in many cases, organizations spend a lot of time just trying to handle objections. And I think you guys lead by example by saying, no, we're going to make it better, and we're going to be bold, and we're going to take actions. And by the way, you demand that of your partners as well. We've been very fortunate at Flywire that with Advent, we built together, we innovated together on the pre-service side to kind of figure out how can we mimic the success that we had post-service, and now get patients to basically check in, see their estimates, pay up front before they even come in, just like you do when you go to the airport. And with Brad and Banner, we've really kind of rebuilt in a very robust way our pre-service and point-of-service financing aspect. And again, we did not come in and said, okay, that's the way to do it. We sat together with the team that, you guys are the expert. You guys are in the trenches and talking to patients and really kind of work together, partner together to make that happen. So really, I truly believe that it's not just about the vision, but it's also about the culture that you guys have inserted. And and speaking about the project that we've done together, Brad, and launched recently with point of service and pre-service, we have to talk a little bit about COVID. Obviously, it's still going on. It's a huge challenge across the board. And it's a challenge for organization. It's an extra challenge for a healthcare organization that needs to both deal with that, just like any other company, but also you guys are the ones that are saving people's lives. We've ran a really complex project to the finish line and rolled it out in the middle of the pandemic. Can you talk a little bit about that? And what are your thoughts about our two teams kind of being able to pull this off in these challenging times?
Yeah, I mean, that's an interesting point because we were fully expecting when we had this disruption that things would kind of grind to a halt, and we were starting to relook at our financial projections and whatnot. But honestly, the team's buy-in to these projects, they weren't willing to let them go. They wanted to see them come to fruition. Our old design that we had of how we treated our patients, I think it became very obvious that that's just not how we wanted to do business anymore. We really weren't into this for trying to get more money out of patients, to be absolutely frank. Banner was a pretty hard-nosed point-of-service collection organization, and we had groomed our patients to realize that, and they had submitted to that way of when you come to Banner, you're going to pay up front. Sometimes we do a 50% or have a package plan, but it was pretty hard collection activity. I think we had 2.5% of net that comes from point of service. Then we'd send out our statements, and they didn't pay it. We'd throw it off the bad debt. It was a pretty basic dunning cycle that we had. And the team really identified that that's not a great way to compete, and it's not a big patient satisfier. You don't get high marks on your revenue cycle when you're that gruff and aggressive with your patients. So looking at how to create a shopping experience, and Tim talked about quite a few of the things that he's done, and we've done similar things. We really threw a lot at this opportunity, from getting out front in the transparent shopping where people can look, adding credit options. Tomer talked about our front-end payment plans, which we just didn't do. Like we weren't talking to you about payment plans on the front end. Either you can pay for it or you can go get it somewhere else. So we were adding that into the front-end workflow, so our staff don't have to toggle between multiple tools. It literally just flows right through the workflow tool. So the payment plans on the front end, the back end, the ways to get to your account and manage your account, add your own payment plans, combine your statements. We also, like trying to meet the patient where they want to be met, we pulled in a virtual patient concierge where you can scan your bill and an avatar comes out and will literally talk to you about your bill. You touch different parts of your bill, and the avatar explains those parts of your bill to you. Again, just another way that, how do you want to be met? And unless you don't want to call a call center, maybe this virtual patient concierge will give you your answers. So we threw a lot at this opportunity, but what was really interesting is we have a broad market, a lot of different facilities in a lot of different areas. They all had slightly different problems, but sometimes the results were not what we expected. Like in areas where you would not think like a virtual concierge app would pick up, it did. In areas that you didn't think they were interested in credit, they took it. And then in places that you thought they wanted payment plans, they didn't. So it's been interesting to see all of our numbers change, where we had a lot of point of service and we were expecting to introduce more credit, resolve those debts, or put more on payment plans. Just really fascinating to see how patients react to, text messages and emails that they didn't get in the past, and watching the numbers move. So in some ways it's been confusing because it's not what we expected to see in certain areas, but it's also been fun to test different ways of engaging with the patient along the way. But Tomer's right. We kept moving through the COVID-19 era. We've gone live with several projects during this period of time. The teams had to reset and find out how to do virtual training and testing and roll things out in a very, very different way. But none of them wanted to see the project stop, although I was absolutely expecting that to happen, and they powered right through it. So credit to the team and the ownership that they feel about these projects.
I completely echo that, Brad. I can tell you on our end, on our Slack channel, you can feel the pride coming out from the engagement managers and the product team that's been powering through alongside your team to kind of say, look, we're going to make it happen. They've been creative in how do they do remotely user acceptance test and things like that. And you can see that it's becoming a lot more rewarding than a regular project that they can work on for 3 or 6 months. And I always say that, when I kind of got into healthcare, I said, look, yeah, the doctors, the nurses, they're kind of at the front line, they're the heroes, but I truly believe that the administrators, they can bring innovation, they can bring a lot of value to the system and really kind of enjoy that and have a lot of satisfaction with that part. And I think this is just a great example of that. Tim, maybe you want to talk a little bit about how you guys have been kind of dealing and addressing COVID at this time?
Sure. Yeah, I mean, obviously, like many providers, the month of April saw much dramatically reduced volume coming into the hospital, much of May as well. And we quickly, in the middle of March, attempted to recognize those consumer pressures with, the potential of increased unemployment or furloughs from various employers, and attempted to roll out what we termed a financial grace policy. So it gave patients additional ability to defer certain payment arrangements and to allow smaller dollar amounts on the recurring payment plans, as well as kind of move forward their due dates until they had a better handle on their financial situation. So those were a couple of the strategies we utilized. It's very clear that it became more difficult to answer inbound phone calls with COVID. We've seen just a deluge of phone calls coming into all kinds of different consumer phone lines. And as a result, it caused an increase in the utilization of our online portal tools, which was, good in my opinion, because it just hopefully in the future that stickiness will continue and the patients will make a habit of utilizing those tools. But that was definitely one of the outcomes we saw as additional usage coming out of the COVID experience. We're getting back to doing elective surgeries and that sort of thing now. And so obviously as we stopped that, the pre-service engagement stopped with it because many of the people we were contacting were for scheduled encounters, upcoming encounters. And so we're kind of putting our foot back on the gas in terms of furthering that pre-service capability and attempting to finish the rollout through the end of this year. But it does present challenges in training and remote work, that's for sure. And if I had all the solutions, I'd share them with folks. But I think as leaders and managers of remote employees, we're still kind of finding our way in how to hold folks accountable and make them the most productive while working from home.
Yeah, and by the way, Tim, I completely agree with you that, not just in our world, but in other aspects of our lives, because of the pandemic, I think there are going to be changes in the world, right? I think there's going to be more people that are going to work remotely. And kind of virtual services, if it's e-commerce or travel that's already kind of been adopting, I think they're going to get accelerated. So I definitely believe that this is just a trigger for people to take action more on their own, and I don't think it's going to go away. I think actually that's an acceleration. The last topic I wanted to touch base quickly before we open up for question is really, at the end of the day, again, you put a strategy, you change the culture, you power through, with different challenges, but it's all about, driving results. And you both kind of talked about it. So I thought I'll give you guys a chance to just briefly talk about some of the results that you were able to generate. Brad, maybe you can start with the Banner Health results.
Yeah. Well, unfortunately, in this area of patient financial experience and patient engagement, there's not an off-the-shelf solution for this. It takes a lot of vendors and tools and collaboration, internal and external, to make something like this work well. Even internally within our organization, working with finance and policies and procedures and compliance, our digital front door teams, all the way down to finance and net revenue and accruals and bad debt. I mean, this has such a huge ripple effect through an entire organization, and obviously the technical side is just one part of it. So one thing we did very early, in which we had a vision that we kind of talked about earlier, is we looked at the different vendors that we thought we could pull together to cobble together that vision we were looking to implement. And we started to have really deep conversations with them about collaborating with other vendors. And that was awkward, frankly. We sat vendors of choice down in a meeting room and talked to them about the integration components we'd be looking for them. And in some areas, the business models overlapped, so you could feel the tension between those vendors. But ultimately, we felt like we were doing something that was unique and doing something that was great, that really was solving the end-to-end patient financial experience. And if we could get those vendors to collaborate together and work together, all the way into integrating into our host systems, then we felt like we really were solving something. But we had to get those companies comfortable with that along the way, make sure they were all incentivized appropriately to work together. And a credit to Tomer and Roberto and many people on his team, there was some friction there, just to be honest, with all the vendors, about feeling like you were playing in their playground or something they wanted to try to do, but they just don't do it today. And we worked through all of those things. And I think we have created a better patient experience and also a better experience for our team members to be able to help the patients by truly integrating these products together and having everything from a shopping experience all the way to a much better patient engagement on the back end. So those are just bits of advice that, really look at all the intersection points and all the roadmaps and bring all the people together early, internally and externally, and have those frank conversations so that you don't get stuck later that won't work, or you stepped on someone else's toes, or someone starts blocking the project because you didn't talk to them, or they had a better idea or another vendor they wanted reviewed. So doing all that in advance, it feels like it's slowing the project down, but ultimately it creates a much better buy-in, and you'll have a much stronger solution in the end.
Absolutely, and I would call out one of the numbers that I really like to see here is 85% of payment plans are made online. Basically, patients opt in on their own, and when I came, everyone was doing it offline. You have to make a phone call, and it's kind of crazy. So people can do it on their own, and you look at the numbers. It's only exceptions that people are calling your staff and doing that, and eventually that translates into better financial performance. With 16% increase in collection post-service, these are really compelling numbers that the project fund itself. P, maybe briefly talk a little bit about the results that you have seen.
Yeah, sure. I would, echo Brad's comments about having to get multiple vendors aligned. I'm probably responsible for several shotgun weddings in that realm as well, as we do have to, stitch together the experience between, vendors that primarily handle estimation and these post-service bill presentment items, as well as financing. So it is a challenge to work through those items, but again, it's all in the service of kind of making an experience for the patient that we can all be proud of. Our experience has been, similar to Brad's increase in the overall collections, and net promoter score is something that we're particularly proud of, where the patients are very satisfied with their experience, and that's something that we pay attention to, and often we'll read the comments in an attempt to sharpen our focus and respond to some of the feedback that patients are giving us, consumers are giving us. Overall, the pre-service engagement does lead to less no-shows because patients are more aware of their upcoming appointments and their amounts due. I particularly am happy about the increase in payment plans, as you mentioned, just because there's very, very low recidivism rate on payment plans that are set up. Somewhere in the neighborhood of the high 90% of people that set up a payment plan originally end up liquidating the balance in the end. Only a very small, less than 10% of those patients end up breaking the arrangement, partially because, we've got their credit card on file and that arrangement just kind of moves on month over month. I kind of liken it to my Hulu subscription. I don't really use it anymore, and I should probably cancel it, but they have my credit card and continue to charge it every month. So it's kind of a hassle to go cancel it. But nevertheless, it results in positive financial performance for AdventHealth. And again, it is balances that they owe and did agree to pay. So again, no more Scouts honor. I promise to send a check every month. That's really been the most meaningful interaction, and moving that process to the front end where you can originate a plan on a expected balance is something that we're continuing to work towards.
I agree wholeheartedly, Tim, and I think, again, for our audience, if you look at the fact that 84% of all payments post-service are being done by patients themselves. Anyone who doesn't get similar results, don't settle, don't compromise. Keep working to get to that point, because when we started, it was practically the opposite, or a 51 plus net promoter score. It's ridiculously high. It's better than Mercedes-Benz. You can get your patients to really appreciate you on billing and payments, which is ridiculous to think about in healthcare, but we're doing it. You guys are doing that, and that, I think, is the standard. And eventually, that's why results are important. A lot of people can talk about what they can do, but you have to walk the walk and you have to deliver those. And I can tell you, I couldn't be prouder of being part of Flywire and be able to do it. I know we're kind of really short on time, probably screw up a little bit the Q&A session. We would love to get back to people that send question and we don't have time, but maybe we can just touch base on a couple really quickly and try and get Tim and Brad to answer. So I see a question as a whole. How do you get a patient who is not comfortable with digital tech to buy into interactive statement engagement? I'll let both of you take that. That's a good one.
Brad, you want to go first?
Well, this is Brad. I'll go ahead and go. I mean, I think with the way what I described earlier is we are trying to meet the patient where they want to be met. Do they want to get on the phone with us? Do they want a paper statement? Would they rather get a text reminder to go to the website? Do they want to have it emailed to them? Do they want to do their shopping online? Do they want to call somebody? I mean, so we're trying to create multiple environments because we have such a broad spectrum of patients and customers and what they might want. We're not really trying to force anyone into a single medium and a single way of engaging. And I think those things are constantly changing over time as people get more comfortable with different types. It is interesting to look at the ages and locations of the people that are engaging in the different mediums, such as our our patient concierge application, which is, we considered a little bit radical, and we didn't think, a lot of people would use it, but the ages and the locations of where they're using it was pretty interesting. And the same thing of who opts in and out of texts and emails. I think you just kind of have to continue to evaluate those things and try to refine what you're providing to patients, and continue to ask yourself, how do they want to be engaged?
Yeah, I would just add, that's commonly one of the pushback that you receive about these kinds of projects is, patients don't want to do this. That there's the 80-year-old grandmother that will never do the online self-service option, and that might be true. And I think, to echo Brad's sentiment, we want to offer a variety of preferences for which the patient can accomplish the liquidation of their balances. But I do think there's plenty of evidence out there that online bill presentment is something that consumers desire, and something that many, many other industries are adopting, from utility companies to credit card companies to various other industries. So, this was really about enhancing our capabilities to keep up with the consumer sentiment and the consumer desire for those tools. But, admittedly, there will always be some percentage that want to, that have a desire to do the legacy method of paper. I would say that that's a bit of a misnomer, though, because if you look at our data, there's lots and lots of people that are over the age of 65 that are logging in and making payments online. My parents are in their 70s, and they prefer to pay bills online for the most part, and have set up most of their bills to go out in various fashions in that way. So I don't think you can just say that people in the Medicare beneficiary kind of realm won't use these tools. In fact, it's really, the data doesn't support that. There's plenty of evidence that the older generation will interact with these tools, and in many cases they prefer text and emails as well. They do not want to make phone calls.
Absolutely agree. We're about to run out of time, so I want to just summarize it and say, we got tons of questions, and I promise everyone that we'll follow up and make sure that we answer those. It's great to see a lot of interaction. I would like to thank Tim and Brad for taking a little bit of time in their busy schedule to partner with me and kind of tell our great partnership and success stories. As I said, I'm so proud to be a partner, quite frankly, to be a friend, and to kind of go alongside with you on this journey that you're on. You're really making a huge difference. I came from kind of the e-commerce vertical, where we try to put some sentiment into what we do, and I think in healthcare it's so intuitive that we're really helping people that are sick and they need to focus on getting better. We just make it easier for them. We just help them figure out how to go and fulfill their financial commitment without having additional stress coming on top of that. You guys lead the way. We try to partner with you guys, and I couldn't be more proud of partnering with you guys. So thank you so much, and thank you for everyone who participated. I hope you enjoyed that. I had a great time. I'm relieved that none of my kids barged in to disturb me in the middle, and I hope everyone stays safe.
I want to thank Tomer, Tim, and Brad for their excellent presentation, and Flywire for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.